Clinical Cases provides interactive virtual cases that reflect authentic patient scenarios to assess and develop students' clinical reasoning skills. As a medical educator, the powerful data and insights within the platform empower me to monitor students' progress and measure their clinical reasoning skills. The Instructor Performance Dashboards empower me to review the quality of their work through the lens of two key metrics: patient outcomes and clinical reasoning accuracy. The outcome scores reflect the patient outcome achieved by a student in each case attempt. It classifies students' work into one of three potential patient outcomes: optimal, suboptimal, or poor. The scores are based on the extent to which the student was able to manage the patient and achieve an optimal outcome. Outcome scores are weighted, meaning some answers are more right or wrong than others. For example, life-threatening or critical errors during a case will lower the student's score. Students are also graded on their clinical reasoning accuracy. The accuracy refers to the percentage of decisions throughout the case that the student made correctly. Students' work is classified into one of three potential categories: above expectations, meets expectations, or below expectations. With those definitions in mind, we'll use the dashboard as we seek to answer some questions about student usage and performance. For example, general usage insights, such as how much are my students using clinical cases? When are they using it? What are they working on? Then we'll use accuracy and outcome data to answer questions about their performance, such as which steps of clinical reasoning are my students most accurate with? Which specialties are they most proficient at? Which conditions are they finding it difficult to manage patient outcomes for? As we get started, note the date selector in the upper right-hand corner is automatically set, which affects all data in the dashboard. Also note that we are viewing data through the lens of outcomes, which is selected here. Within the outcome graphics, note that red represents poor outcomes, yellow represents suboptimal outcomes, and blue represents optimal outcomes. First, I can see the number of cases attempted and the range of outcomes. The bubbles are sized proportionally based on how many cases have been completed by specialty. At a high level, I can see that most completed cases are from the internal medicine specialty and that most outcomes have been suboptimal. I use this data regularly to check in on the volume of cases attempted and for a snapshot of the specialties my students are taking cases from. Now that I have a view of how my students are using the platform, I dive deeper into their performance by content categories and look at conditions and specialties. Firstly, a high-level look at conditions. The table displays all the conditions that my students have attempted, showing the average duration, accuracy, and outcomes. I want to know which conditions have had poor outcomes, so I filter accordingly. Next, I move on to specialties. These are listed with a split of the outcomes achieved in each. Remember, the level of outcome achieved is indicated by the colour. Using this page, I have gained a high-level view of the volume of cases completed, conditions and specialties that could be addressed. Now, I will dive deeper into a specialty. Each specialty has its own page. Like before, I can see the number of cases attempted and the range of outcomes. Our medical school often has different staff teaching different specialties, and each of us can review performance specific to our respective specialty. Similarly, when my students are on placement, I want to track if they are consistently practicing cases, so I'll use the week-by-week view to review that. To dive deeper into the conditions within this specialty, I use the table at the bottom. Within this table, I can see detailed performance data for each case within this specialty, such as conditions that have been attempted most and their outcomes. Next, I take a step deeper into the content and look at a case. I'm curious to see how much time my students spent and the spread of outcomes achieved. Perhaps we'll review this case together in class. Now we're going to look at performance data through a different lens. To better understand students' clinical reasoning skills, we're going to view data based on accuracy. As a reminder, Accuracy data calculates the percentage of choices that the student made correctly during a case. For example, 21% of cases were completed with an accuracy score above expectations. I want to understand which steps within clinical reasoning my students are finding difficult. It looks like they're struggling with this specialty, so I click to take a closer look. Within the specialty page, the spider chart shows average accuracy scores for each step of clinical reasoning within that specialty. For example, here my students are strongest within examinations and diagnosis, while weakest within investigations. I want to know if this is a recent trend, so I review their clinical reasoning accuracy over time for each clinical reasoning skill within the specialty. For example, I can see that investigation accuracy has consistently been below expectations, while examination accuracy has improved in recent weeks. Finally, I review which students have been the most and last accurate with their clinical reasoning. This will help me plan the best course of action for remediation. With the knowledge of these insights, I'm empowered to monitor students' progress and measure their clinical reasoning skills.